Welcome back. It's me, Geno, Demeray Chiropractic, and we're working with Jens today, who has had an ankle injury and it has worked its way up into his hip, and he believes that he may have some sciatic issues. In the process of the ankle injury, he has compensated on the right side, and now things over here have gotten tight as well. In the first video, some of you saw I applied some gentle traction to the ankle, as well as some compression and some deep pressure work down the middle of Jen's calves, just to kind of release the tension and increase some of the circulation, so that as I move my way up to the hamstrings and eventually the glute complex or the hip complex, then we'll understand exactly why I had to start from the bottom up. It's important to know that the feet are the baseline of your entire body. You walk on them every single day. So anytime you have an ankle injury or any type of foot injury, anything of that sort, you're going to have stacked issues that work their way up. And sometimes people will feel anything done to the foot all the way up to the neck. So if there's something done, it's always good to start at the feet and work the way up. So we've already had Jens warmed up through here. How you feeling today, Jens?
Good.
Good? We have plenty of water?
Yep.
We did. Fantastic. It's always good to drink plenty of water pre and post massage. Reason being is because a lot of people can't handle massage when it's to this degree, and a lot of times drinking water helps hydrate the body. When you hydrate the body, you hydrate the skin, you hydrate the fascia, and you hydrate the muscle. So when I go to apply pressure, you don't feel pain, the body's ready for therapy. Right now what I'm doing is I'm doing compressions on Jen's hamstrings, because I'm eventually going to apply some deeper pressure. That may cause him some discomfort because it's been a while since someone's kind of gotten in here and worked out these knots. Jens, how we feeling?
Good.
Okay. And I'm just using simple knuckles. Got something there. So as I work up right through the middle here, how's that feel, Jens?
That's tight.
Very, very tight. Okay. As a therapist, I strongly encourage to save your hands, save your fingers, and save your thumbs. When you're dealing with large muscle compartments, it is always beneficial to use your fingers to find the area. When you know the area is greater than the strength of your fingers alone and you can do better work with forearms and elbows, utilize them effectively. Start off slow, circular motion. Jens, do me a favor, taking a deep breath. Nice, exhale. Sweet. And then I hold. Now, as I have my elbow here, having a nice area, I use my left thumb and I go around the area where I'm placing pressure, just to kind of see if there's anywhere that I need to shift next, where I can have Jens do a simple breath and I can knock out two birds with one stone. Jens, how's that feeling?
Good.
Starting to decrease? Sweet. All right, I need you to take a deep breath. I'm actually going to shift up and to the left, okay?
Oh.
A lot of times when you shift laterally or to the outer portions of the legs, you experience more pain. Just like if you go towards the middle of the leg, you experience more pain. This is because a lot of people don't stretch like they're supposed to. It's important as we get older to stretch at least 15 to 30 minutes every morning and every night. How we doing there, Jens?
Good.
Sweet. So at this point, what I like to do is I like to go ahead and work my way on up, because now we're going to make our way to the hip. How you feeling? Tighten there? Gotcha. Now, what I usually do is when I start to get into the heavier portions of the muscle, we already know it's tight in there. I don't need to use my fingers because these are deep, deep, thick muscles. So you can usually feel what's going on with the elbow, and I feel something right there. Are we ready, Jens? We're going to apply another pressure. You good?
Yep.
I'm going to wait for your breath. Go ahead. Nice. With each breath under my elbow, I can actually feel the tension in Jen's muscle releasing. So I usually know right before he's going to exhale, because the muscle will release, and as it releases, he feels the release as well. Jens, how we feeling?
Good.
Nice. All right. Feeling good through here?
That's a little tight on you.
I was gonna say, right here. All right. So again, large muscle compartments. We've hit, this will be our third spot now. You see what's happened on the way up? So it becomes a project, and we haven't even hit his main concern, which is his hip. Right in there.
Mm-hmm.
Okay, take a deep inhale for me. Exhale.
Oh.
A lot of times there will be increased sensitivity because there are muscle compartments, which means that each muscle needs its own individuality. Every single muscle, for example, the hamstrings. The hamstrings consist of the gastrocnemius and the soleus. The gastrocnemius has two bellies, two heads. The soleus is in between them. But yet those muscles need their own space. At one point when you don't stretch or when you don't have manual therapy done, there's a fusion that takes place. And when that fusion takes place, right here in this area where Jens is experiencing more pain than usual, there's a fusion between two of those compartments of muscles. Jens, how are you feeling?
Burning, starting to melt away. Oh.
Take a deep breath in for me. Nice. And release. Okay. So, what I usually do is, the reason why I ask Jens to take a deep breath in and out before I do a release is if I let go of a muscle, an innervated muscle too soon, and there's already pain being inflicted, the patient may contract quickly as I let go. And when I let go, that causes twice the pain. So if I have him focus on breathing as I'm letting go, the muscle will relax and he won't experience any pain as I'm releasing from the area. And Jens, how we feeling?
Good.
Feeling better through here?
Oh yeah.
Nice. Okay, so what I'm going to do now is we're going to go ahead and work our way up to the hip, and I'm going to test your range of motion on the hip, okay?
Mm-hmm.
So what I usually like to do to see if there's, check the external and internal rotation of the hip. So I'll bend the knee, and we go out. See how far I can go. Jens, how's that feel?
Good.
Feel okay?
Mm-hmm.
Let me know right when it starts to feel uncomfortable.
There.
Right here?
Mm-hmm.
All right. So as I start to rotate the hip laterally or out, you have what are called your adductors or your inner thigh muscles. These are the muscles that control the joint up into the hip and allow movement. So as I place pressure on the inner thigh,
Oh.
the leg begins to move out more.
Oh.
Keep breathing. Nice. And I usually do this a few times because, of course, this is new. No one does this stretch at home by themselves. So this is not something that you do aggressively. You kind of warm your patient up to this. And then we stop. All right. Go ahead and let that shift a little bit. How's that feel?
Good.
Pretty good?
Mm-hmm.
Feeling good? All right. All right. So this is something that I kind of want to note. As I put Jen's leg over this way, we have a rise in his hip here. What that's showing is that there's a decreased range of motion in the hip, which of course is the primary complaint from the ankle sprain. So as I hold Jen's here in a flexed position, I'm now back to our compartment in the hamstrings, and now we're kind of hitting over to the abductors. So your abductors are right along the lines of the lateral hamstrings, but they also are in conjunction with the IT band and the tensor fasciae. Those are muscles that over time you just kind of, they're in the leg and they're associated with sciatica and hip problems. Your therapist knows about them. Contact your local chiropractor. All right, so as I go up, because of the decreased range of motion, what we have here is I check the outer portions. So as I apply the same pressure as before, I'm finding the tight areas that are preventing his hip from doing this. All right. Now I'm going to do a hold. I feel like his tightest area is right in here.
Yep.
Okay. On the count of 3, take a deep breath in. 1. Yep. 2. Nice. And on the 3rd, I'm going to push. Ready? 3. To some, it can sound like labor. Male Lamaze teaching actually works for this. So those Lamaze classes that you take with your wives, practice them when you go see your therapist. How I feeling? Feel a release? Good deal. All right, work my way up. Now his leg is kind of comfortable here. Okay, I don't have to hold it here anymore. Before with the restriction, it would jump back. So now that we're here, I don't have to focus on holding it. I can reposition myself so that I can now start to focus more of my energy here into this outer hamstring and up into the hip. Okay, so right in here, what we have is what we like to call our sacrotuberous ligament. It's a ligament that is attached and also goes into the hamstrings, but it ties into the hip. And a lot of times what I'll do is with the forearm, I'll apply an upgraded pressure right against here to allow a decrease in the pressure that's caused right here at this junction of the hip and the hamstring. So, right in this curve, check back and forth. Jen, do you feel some tightness in there?
That actually feels all right.
Feels okay?
Mm-hmm.
Okay, I'm going to apply some pressure, okay?
Mm-hmm.
All right, on the count of 3. 1, 2, deep inhale, 3.
Oh. Oh.
It was okay. Sometimes things feel okay when it's superficial, but the pain and the issue is a lot deeper. Nice. Jens, what do you feel right now? What are you experiencing?
It's hard to put into words. It's kind of a like tingling, but almost burning, sharp, but it's melting away. So
Melting. It's my favorite word. Because when you think about that, when a muscle's tight and it loosens up, it literally feels like butter melting in your hands. All right, I'm gonna go south a little bit, okay?
Okay.
I'm gonna go down. You ready? All right. 1, 2, deep breath in. Exhale. Yeah. Yes. If you can get a little closer, we have a little bit of involuntary muscle spasms. Maybe we can catch them. If you pay attention here, there's some spasming over there. I'm gonna move. Keep breathing. Spasming going on here. The leg. And relaxation. Perfect. All right, how we feeling, buddy?
wow.
Okay, so that's our hamstring edition for the day. We're going to go ahead and we're going to actually get more into that hip, more into that hamstring complex, and definitely hit that piriformis to find out exactly if that sciatic nerve is causing Jen's problem. My name's Geno. It's good working with you, and we'll see you again soon.